And according to the GSLP manifesto, there are lots of things that they're talking about improving, increasing, more mental health support in education, mental health locally trained counsellors, an increase in those, more school counsellors. So there is quite an emphasis on trying to provide a better service throughout the community, but particularly focusing on children, because of course if you catch or you diagnose some of these issues early on, it's less likely that they are going to become really entrenched.
We know that you've also expressed concerns in the past about continuity of care.
Well, continuity of care, that's a tricky one, because it's to do with the professionals. We have met with a number of professionals who have told us that they haven't been happy in the way that they've been treated, or they don't get the support that they needed. In terms of, for example, supervision. If you're a counsellor, if you're a psychologist, you need to have something that is called supervision, where you yourself speak to somebody who is on the same grade or above about whatever issues you're talking about. And I know that in the past it's happened that professionals haven't had this paid for and they've had to do it themselves. And sometimes it happens that they're not very happy with the structure or lack of structure. And so that's why we say that it's important that when they do get mental health professionals, that we have a system in place where these individuals want to stay on and not leave, after a year or 2 years. That we need to create a situation as far as possible where they will want to stay, so that people have continuity of care and they don't see 4, 5, 6, as has happened, psychiatrists over a period of a few years. And something else that we've called for is a formal mental health budget, which adequately reflects the importance of mental health. I mean, we've had the politicians now, the leaders of both parties, talk about how mental health is as important as physical health. But, that has to be translated into action. And we do feel that over the years, things have improved in mental health. Certainly, there is much more awareness. There is much more of an effort to try to facilitate things. But we feel that there will always be a lot of work to be done. But there is still work to be done also in terms of providing a better mental health system, because you also have a more coordinated system between mental health and the care agency, for example, because the care agency has a crucial role to play.